Hey guys, it's me, Danny, and I'm really excited about this episode because you and I are going to be learning hands-only CPR. Yes, that's a thing, and it could save lives. And that's all on this episode of Everything 101. Let's get to it. All right, hey guys, welcome. So I'm here with Mitzi Williams. Mitzi is a nurse practitioner with 23 years of medical experience, right?
That's it.
So we're going to be learning hands-only CPR. Now, I was, always think of CPR as mouth-to-mouth resuscitation. So can you just kind of give us an idea of what hands-only CPR is?
Yeah, so some research looked into reasons people don't offer immediate assistance if somebody collapses in front of them. And mouth-to-mouth has been a big barrier to having people step in and try and help somebody with CPR. Mm-hmm. So there was some research done that showed really if we take mouth-to-mouth out of this, people are more willing to jump in and help. Mm-hmm. But also it doesn't really harm survivability. So the patient still gets what they need, more people are willing to assist, and that's really what we're looking for, is more people get CPR with a better chance of survival.
Awesome. Because, I would guess that cardiac arrests are super common. How many out-of-hospital cardiac arrests happen every year? Do you have any idea of what the number is?
So it changes year to year, of course. There's no constant, but it's roughly 350,000 out-of-hospital cardiac arrests a year.
Wow. Okay.
Yeah.
So how many survive with CPR?
So it's still not great. I'm going to be honest, that cardiac arrest is a really big deal, and it is deadly. But what we know is that in the past years, about 50% of people got some sort of immediate assistance by bystanders. But still only about 10 to 12% survive to hospital discharge. It's not great, but if we get more people intervening, if we get early assistance, if we get early intervention, that's really the patient's best opportunity to survive.
Yeah. Okay, so this is going to help us motivate people to jump in because somebody watching is going to deal with this at some point.
Somebody watching is going to deal with this at some point. And really what we want to say is, this is a safe way for the person trying to help, right? There's no risk of communicable disease. There's no mouth to mouth, but you can really make a difference and increase their chances of survival.
Awesome. Okay, so taking the mouth to mouth part out, why does the hands only actually work without that component?
So it works because standard people have enough oxygen already in their blood to perfuse the organs, right? We have enough oxygen just in supply. Mm-hmm. So we don't need to add more, but what we need is for the blood to circulate. We just need blood to get to the vital organs like the heart and the brain. That's really the most important. So with enough oxygen already in the system, we just need blood to pump. So hands-only CPR is this external pump to just replace the heart temporarily.
And I'm assuming that you should always have somebody call 911 immediately.
Yes.
And then jump while you're jumping into action. So
yeah, best case scenario is we have somebody immediately jumping into action and we have somebody else calling 911. If you're by yourself but there's people around, it's immediately intervening and yelling out for help. Somebody call 911, I need help. Worst case scenario, you're by yourself. Can you get a phone to where you are? But the most important is let's get 911 notified. Let's get somebody on the way, and let's immediately start to pump the chest.
Yeah, help them. Okay. Mm-hmm. All right. So how does it work? Can you show me how to do it?
Absolutely. I'll show you. So the most important thing is checking, are they unresponsive? Okay. So are you awake? Are you okay? Breathing or not, doesn't matter. But let's check for a pulse. You can check on the side of the neck. You can just check your own. You'll be able to find it on the side of your neck. Can I feel the pulse? If there's no pulse, hands in the middle of the chest, push hard and fast. And the goal is about 100 beats a minute, and you're just going to keep it going. Okay. Just keep it going. Now, if the person wakes up, that's fantastic. Yeah. That's fantastic. Somebody might wake up and be like, hey, I'm okay. Wonderful. then they're good. We still need 911. We need to figure out what happened.
Yeah,
if
right.
they wake up, stop. Everything's okay. But if they don't, keep going. Hands in the middle of the chest, pushing hard and fast, 100 beats a minute until help arrives.
And we've probably all seen different things about the song Staying Alive.
Yep.
That's a good way to keep 100 beats per minute. But there's actually a 100 beats per minute playlist, isn't there, on Spotify?
There's a 100 beats per minute playlist on Spotify to explore all genres of music.
Yeah.
Here's what we need. We need the hands to be in the middle of the chest,
Yeah.
pushing hard and fast at 100. However you think you can do that, do it. But if it means singing Staying Alive inside your head while you're doing it, whatever it takes.
Gotcha. Okay. So I want to ask a couple of other kind of outside questions outside of doing the procedure.
Okay.
Should we get certified to do this, or is just learning this enough right now?
So always more education is better, right?
Right.
If you know more, that's fantastic. If you can get additional education, go for it. But this is enough to help you intervene. Here's what we want. We want the general public to feel comfortable intervening. Someone has collapsed. They're completely unresponsive. I can replace their heartbeat temporarily until help arrives, and I have the knowledge to step in and help.
Yeah.
That's really what we're looking for, is people to not be scared or not believe that they don't have enough training. Step in, put your hands in the middle of the chest, push hard and fast, do something to increase their chance of survival.
Okay. Can we hurt somebody in this process?
So yes and no, which doesn't sound like a great answer,
Yeah.
right? But let's picture the big picture, which is they're dying.
Yeah.
This person is dying. So there's nothing we can do to make this situation worse.
Right.
It's the worst it could possibly be. So what is the yes? There is a chance that when doing hands-only CPR, ribs may break.
Okay.
Again, if we have broken ribs, but we've perfused blood to the heart and the brain, that's survivable.
Yeah.
But if we don't do anything, this is
That's it.
absolutely not survivable. So it can't get worse than this. Do something.
You can only help.
You can only help.
Okay. So you were telling me about an app that you can use also to practice?
Yeah, so in this particular case, this CPR dummy that's been provided to us comes with an app to show that our compressions are effective.
Okay.
So this is a good way to practice if you have the resources. Not everybody's going to have access to a smart CPR mannequin that has an app available. That's fine. There's lots of ways to practice that really is just with a pillow on the couch, anything. But it doesn't require a lot of practice, right?
Okay.
This is a very simple thing. That's why it's so important to get the information out that anybody can help. Hands in the middle of the chest, push hard and fast. But if you want to practice this, pillow on the floor at home, anything, playing a song in the background, just, if that helps you feel more comfortable stepping in to help.
Gotcha. So a lot of people are, as we've talked about, people traditionally have been a little hesitant to step in. And I think we can all agree that that's probably because of legalities. So are people protected if they step in and do this procedure on somebody?
Yeah, they are. So all 50 states have a Good Samaritan law. There's some small differences from state to state about what the Good Samaritan law entails. But overall, if you work in good faith with an expectation that you are trying to offer the best assistance to the person, and there's no expectation of financial payment, right? We're not asking anybody to pay us because we did bystander CPR.
Right. Yeah.
So these are the things that would cover you, that says, look, I was acting in good faith to do the best I could at the time. Then yes, you are covered by Good Samaritan laws that says I was trying to help. I did the best I could.
Okay, so don't be scared to step in.
Don't be scared to step in.
Now, can we do this on a child? Because we all want to step in and help out a kid, but...
Yeah. Absolutely. So this particular video that we're recording today doesn't cover infant and child CPR, but absolutely. The thing that gets a little tricky with children and infants is most of the time, if their heart has stopped, it's because there was a breathing issue first. There's some exceptions to that, but for the most part, kids and children, will have a cardiac arrest because of a respiratory issue.
Okay.
So they need assistance breathing more often than not. This is a choking incident, a drowning incident, something like that. Okay. So yes, you can. If you need to assist a child or an infant with CPR of some sort, you just scale down the effort. Okay. So for a small child, one-handed CPR is okay. And I don't have an infant with me, but we could do another video with infant and child. But for an infant, you would be able to hold them with your hands encircling their chest and pushing the middle of the chest with your thumb.
Okay.
Yes, it still works. You just scale down that effort to the size of the person.
Right. Okay, well, it's pretty simple process.
Pretty simple.
So last minute tips, summary, what do we need to know?
So I think the last minute tips is if you have come upon somebody that is collapsed and unresponsive, feel for a pulse. If you're not sure, start CPR. If they have no pulse, we cannot make this situation worse. Okay. All right? Put your hands in the middle of the chest, overlap, push hard and fast in the center of the chest at about 100 beats per minute, and keep going until help arrives. One thing to keep in mind, you're going to get tired.
Yeah.
You're going to get tired. The muscles just weaken. There's a lot of adrenaline in this situation. I've done CPR a lot of times in a hospital scenario. Arms get tired, and there's a lot of thoughts happening at this time because this is an emergency.
Right.
You're going to be tired. Keep going. Just keep going till help arrives. Yeah. If there's additional people on scene, you can trade out for rest time. That's what we do in the hospital. Trade out people that are providing compressions, but keep going until help arrives.
Okay. All right. Well, it's
You want to give it a try?
Sure.
All right. You've learned everything you need to know. Hands in the middle of the chest, push hard and fast.
Okay. Sing the song for me. Okay, never mind. All right. How's that?
That's it.
All right.
Keep
That's
going.
pretty simple.
That's it.
I got to keep going. Okay. All right. Well, I want to thank Mitzi for hanging out with me today on Everything 101. Guys, it seems really simple, but practice, because you really never know when you're going to need to step in and help somebody. And we always want to be available to help somebody when we can in any way possible. So thanks again, Mitzi. Appreciate it. That's it for this episode. I'll see you on the next time on Everything 101. See you soon.